Hi, Dr. Bilski here, and I am here to talk about why your fillings matter. And if you knew that you had an option between a good filling material versus an adequate one, like the commercial says, is it okay just to accept okay? Well, at the Bilski Dental Group, we don't think that that's okay. So I'm going to talk about antibacterial filling materials that have been around for about 2 or 3 years. And from the research that I've done, it seems like, or not seems like, it's actually true, that I'm the only dentist that's providing these materials in a 60-mile radius of Independence. So, of course, you go 60 miles north, I'm in Lake Erie, so no one's developing them there or providing them there. So in our practice in Independence, we use the antibacterial fillings. And what you're seeing there is before and after of old silver filling. And did you know that those fillings only repair the teeth? It's just like a putty. It's a hole. It's hardened. It's silver. It has mercury. Versus the tooth-colored fillings, maybe a lot of us have already had, but they're still inadequate. So that we're finding that the fillings that we've placed 3 or 4 years ago, 70% of those fillings are due to the edges of those fillings where they meet the teeth breaking down because the bacteria collects there. So with the new material, it has a substance called quasi, is the easiest way to say it, quasi particles. It's quaternary ammonia silica, and it's permanently embedded into this material, tooth-colored material. It disrupts the actual cell's wall, the bacterial cell wall. So it kills bacteria. So we're finding now by placing these fillings, we don't have what's called recurrent caries, recurrent decay. Doc, I just had this filling placed 2 years ago, and you're telling me I have another cavity? Yes, you do have another cavity, and that's due to the bacteria and the materials that have been substandard, inadequate. They do the job, they fill the tooth. However, there can be breakdown and you may need to have new fillings placed. Just a side note, public announcement. There's always been the argument of fluoride and no fluoride. These fillings do not have fluoride, and we 100% rely on antibacterial fighting from the quasi particles. So no fluoride. We talked about how it fights the bacteria. The other key important topic here is that our mouths are usually at a pH or an acidic environment of neutral. So 7. This keeps our mouth pH above the critical level of 5.5 where cavities start. So when people come in and say, I keep getting cavities, like, do you have dry mouth? Do you drink a lot of sugary drinks or do you eat a lot of sugar? If they're saying yes, that creates a fermentation that drops the pH, which means it's more acidy. So they have an uptick of bacteria in the mouth. So we just use numbers. Say there's 2 million bacteria in our mouth that are populating these teeth, and then you have a decrease in pH, more acid environment in the mouth. It creates more of an environment for these bacteria to multiply, and they actually start to eat at the tooth where the filling and the tooth meet. It's a nice little environment. The recent studies show that this type of material with the quasi-particles happens to do what it says it does. And my question to you is, again, if we know that there's something better, why wouldn't we choose that? And it reminds me of the story of my son. He's an artist, he's an author, and he goes to these little markets, and he has a setup, and he has a little typewriter. You can buy a poem, and he makes it right there, types it up right that day. And on one side, he says, $5 for bad poetry, $10 for good poetry. You choose. What we're saying here, if you need an option and you want to talk to me about the alternative, I'm the only dentist in Northeast Ohio that takes care of this type of filling material, that provides it to our patients. And why this matters, it's cutting-edge dental technology. It's superior long-term compared to the other ones. Again, if you had something better, why would you take the worst when you can have the best? And then reduced need for future redos of fillings. Now that all depends on lifestyle. You brush, floss, and water pick. Come and see me at least twice a year. This should mitigate recurrent decay. Hope to see you soon. Look forward to it.